Good morning, everyone. Thank you for being here. Today is my pleasure to introduce you my friend, colleague, and mentor, Dr. Carmen Rubio, who's going to talk about non-invasive PGTA. Carmen, when you want the floor, it's yours.
Thank you, Nasser. Good morning, buenos días, buongiorno. Thank you for coming. I can see a lot of friends among the group, so thank you for joining us today. I'm going to comment in 10 minutes. I will try to be short what we have been doing in the last year regarding the analysis of the cell-free DNA in the culture media. You know that the technology has evolved in the last years in a huge way to be able to analyze DNA in different ways. And we started with vis. Some of you were with me when we were starting with vis analysis of day-free embryos and 𝗘𝗠𝗕𝗏 biopsies. Then we had the possibility of applying molecular technologies to the analysis of the biopsies, and this really changed the field of PGTA, being able to analyze the 24 chromosomes. And since we started with the NGS, we have now a technology that can detect chromosomal abnormalities in small quantities of DNA. And this technology can be applied also to the detection of DNA in the culture media. This DNA that the embryos release while they are growing in the lab up to blastocyst stage. We have been working with the idea of developing a non-invasive approach to analyze the chromosomal status of the embryos. And we were thinking this was going to be impossible, but little by little we have gained knowledge about the possibilities of this cell-free DNA in the culture media. We started with the first publication in 2018 as a proof of concept, and later on in 2019 we were improving the lab protocols and the NGS protocols to try to get the best of this. And in 2020 we were able to publish the results of the interim analysis of a big study in which we were able to reproduce the results in different centers with different culture conditions. So I'm going to summarize a little the main findings of these three publications and of our research so far. So this is the results of the second publication that we did in collaboration with the group of Laura Rienti and Filippo Galdi in Italy. And we had the opportunity with them of testing the cell-free DNA of unmanipulated embryos. And this was very important. So we wanted to compare the results of the cell-free DNA with the results of the 𝗘𝗠𝗕𝗏 biopsy, but with a previous assisted hatching, without a previous vitrification, so intact embryos. And in this lab, they were doing the biopsy without previous hatching. They were doing just the hatching right before the biopsy. That's why we have these possibilities. And with 108 embryos, we were able to see how modifying a little the conditions in the IVF lab, we can have very good concordance results by avoiding contamination. And in this paper, we were trying to set up the best timing for media collection. And we learned that by collecting the media on day 6, we can have really very high concordance rate, 84%. And this is very good concordance rate because if we go to different studies published so far, most of the studies published comparing 𝗘𝗠𝗕𝗏 biopsies or full blastocysts with media come from embryos that were previously vitrified or previously biopsy donated to research. So with completely unmanipulated embryos, 84 concordance rate, it's very good. And if we go to previously vitrified embryos donated for research, we have done also this study with embryos from previous PGTA cycles or just embryos without PGTA that are frozen blastocysts that we thought we culture and we analyze. And then in this study, we have seen that the concordance rates can be as high as 90%. And we have learned that if we have day 5 frozen blastocysts, if we thaw these blastocysts and we keep culture for 24 hours, we can have very good concordance rate, 91%. And even for day 6 blastocysts, imagine in a patient that has a previous cycle that has not worked and you have spare frozen blastocysts, you can thaw the day 6 blastocysts, keeping culture 6 to 8 hours, and the concordance rates are going to be very good, 90%. The important thing, there are two important things to consider with non-invasive PGTA. The accuracy, so the concordance rate with 𝗘𝗠𝗕𝗏 biopsy of the full blastocyst, and the informativity. So we need to get information from most of the samples. And for this, it's very important that if we have day 5 blastocysts frozen blastocysts, and we thought, and we give it culture just 6-8 hours, the informativity rate is going to be only 50%. Concordance rate is still good, but informativity is going to be low in day 5. So can we do non-invasive on day 5 for fresh or frozen blastocysts? Yes, but the informativity and the concordance rate can decrease, mainly the informativity. So that's why we have been developing the protocol for early day 6 blastocysts. And in this study, that was a study in which we included more than 8 centers all around the world with different culture conditions, different incubators, different embryologists, we were able to test for consistency. So the protocol can be reproducible just following like very easy, simple steps to minimize the risk of contamination. And what we learned in this study, we have the possibility of having also inner cell mass biopsies from a collaborating center. And you can see here that the comparison of the hes𝗶𝗣𝗚𝗚𝗏 medium with the inner cell mass gave us a concordance rate of 84% and very close to the concordance rate of the trophectomy biopsy with the inner cell mass. So we have a good tool now to do a screening for the chromosomal status of the embryo in a non-invasive way. We are aware that we have the risk of contamination. That's why we are not proposing this as a diagnostic test, but as a biomarker to help us to prioritize the embryos for transfer. And what to do with contamination? We have learned a lot during these different studies that we have been done, and also with the clinical application, because we have started to apply this clinically 1 year ago exactly, and there are more than 30 centers all around the world sending us samples. So we have learned how to modify a little the IVF lab protocol to minimize contamination. We have to be careful with the contamination from the cumulus cells, polar bodies, and external contamination in the IVF environment. And by simple steps during the IVF lab protocol with particular washes and oocyte denudation, we can really minimize a lot the contribution of the cumulus cells contamination. And in the external contamination, there are basic concepts of how to work in the IVF lab, how to clean the surfaces, how to prepare the dishes, basic concepts that really help to avoid contamination. So with taking all of this into account, I can show you the results of the validation that we have performed in the centers that we are receiving samples just in Spain. So before starting the clinical application, what we do is to do a validation of the IVF center to see how the protocol is working, and you can see how all of them reach more than 80% of the cases. Our average concordant rate now is 86%. It's working nicely with conventional incubators, but also with EmbryoScope. Slightly different protocols, but it's working very nicely. You can have here some results on how this is working, full concordance, partial concordance. In some cases, we can have an abnormality and the media can be contaminated and we can have a female result. So this is what we should avoid using the right protocol. That's why it's very important to receive the proper training and the proper information. And we have some cases in which maybe the trophectomy biopsy is normal and the medium is abnormal. And what we have learned is that in these cases, maybe even though the trophectomy biopsy is there, if the embryo is abnormal, the ongoing implantation rate can be decreased, meaning that the medium is giving us important clinical information. So this is what we have done so far. We know that we are modifying a little the conditions of the IVF lab protocol, but we have tested that this is not affecting live birth rates. We have nice ongoing clinical pregnancy rates. I invite you to go to the presentation of this poster tomorrow, showing some clinical benefits of this in young patients. And we keep on doing research. We need to keep on going. This is the early stage of the non-invasive. So we have a long way along. We are learning a lot, and we keep on doing studies. The randomized trial with a non-selection part will allow us to improve year by year the algorithm to do this prioritization for embryo transfer. So this is everything I wanted to present today. Thank you.